Do you think that, looking back, there's any way that the ECB could have been structured in order to be more innovative and in order to get that funding that would have enabled them to do so? Sorry, my name's Lucy Heaven-Taylor.
Great, thanks. And I'm going to take 3 or 4 questions before we start with answers. Over here.
Hi, it's Ben Emmons, and linked, I think, to Lucy's question, and it was really for Graham. When we look at 12 million over 5 years for 7 agencies, and then we break that down and say, actually, that's not very much per agency, isn't that... I'm curious about that thinking. I know it didn't quite play out like that, but were there different ways of looking at how the money could have been allocated? So, for example, a couple of million for each of the 5 regions given locally, would that have had a different outcome? That could have been a huge impact, potentially. So any thoughts really on that?
Thank you. I'm going to take a couple online, and then we'll refer back to our panelists. And Harun, I hope you're still online. Are you there? No? Okay, we'll hope he'll rejoin. I've got one here from Heather Pearson, who's a global mental health consultant. And she says, did the capacity building project consider the inclusion of persons with disabilities in the project? And then one from Mikkel Erland Jensen, who used to work on the NGOs and humanitarian reform project with the Danish Refugee Council and ICFA. He says, I'd like to hear if this project experienced a growing gap between the professionalizing international NGOs and local NGOs, i.e. due to accountability standards. So if that's clear. Yeah. Okay, so we've got 4 questions there. I'm going to start with Graham, because a couple were directed specifically at him, but others are welcome to chime in. Go ahead.
Yeah, on the question of could it be structured differently, I mean, you've heard me critique the way it was structured, and I spent the last 5 or 6 years racking my brains to see if there was a different way to structure it. I think if there's one message is you need all the money before you embark up front. That would have been different. That would have resulted in difference. If there was absolute clarity on where the money was coming from and what we're going to do with the money, rather than make it up as we go along, that would have helped enormously. And I think that's one thing I would have gone for. And with the point about dividing the money between regions, in a sense, in retrospect, yes, we might have got more value if we just given all the money. But there were expectations that came with the money about doing organizational global-wide transformation, and therefore, no, we couldn't. We could have given all the money to countries and pretended we weren't going to do any kind of organizational development work, and that would have been fine. But that wasn't in the original deal, which maybe it shouldn't have been.
Okay, John, did you want to comment?
Yeah, just really quickly. I mean, the difference actually, there was quite a lot of allocation to the field level. And I noticed that as an advisor, because the first phase we had our own budget, if you like. The second phase we were in a supporting capacity. We had no budgets. It was up to them to decide what they wanted to do. So actually they did have certain budget. I think that just some kind of reflections of some debates that we had at the time. For me, I was arguing actually that why do we put the match in terms of actual dollar terms? Because actually, if you measured people, if you looked at actual people's time, how much they spent on this thing, and willingly, very voluntarily, and also in terms of the in-kind contributions, if you like, the results. If you can use a different way of measuring that, then you would have got well more than the 7 million, I think, if they actually calculated that way. But I think it was, for me, I mean, we're in a safe space, right? So for me, the IWG principles sort of saw that much more as kind of, okay, this is the budget we need, and didn't really look at innovative ways to actually put value on that, because there were a lot of examples of leveraging those, using that sort of small money that was allocated thing in terms of leveraging additional things. So actually there was quite a lot of budget there, and something that wasn't counted also. I mean, I don't know if Harun's back on the line, but I know that they've actually leveraged quite a lot of funds, including for follow-up activities. In terms of the structuring, some of the things, I left my part-time position in CARE when they were still talking about continuing into a phase 3. And so one of the kind of options that I liked was if we take the Humanitarian Innovation Fund example, where you basically have a grant where you're kind of proposing for innovations. That's the Innovation Fund. But why can't you do that with the ECB type thing? Why can't you do it for a collaborative type thing where you have a kind of pot of money, if you like, and they're bidding for that, with the understanding that there needs to be this kind of support capacity there to help support and coordinate and this type of thing. So there always is that sort of associated cost, but why not make it a little bit more flexible in terms of how you actually fund the thing?
Thanks. Yeah,
Can I
Graham.
just clarify one thing on that? I'm aware that the ECB project did achieve a lot of leverage, but we weren't allowed to count that in our report back to the donors as the matched funding. There was lots of time that people spent, but that was meant to be in addition to the hitting that $12 million mark. The accounting for what the donors wanted was very particular about that. It was the rules that we had set ourselves. There was plenty of thinking about getting extra money, but we just weren't allowed to allocate it to the ECB project in an accounting sense.
Yeah.
Thank you. David?
Yeah, I'll just say very quickly in response to the question that Lucy raised, and particularly thinking about going forward, how this experience impacted on the way I think about things now. It's I felt, looking at it on paper, the ECB project was genius. It was an intellectually genius, but for me, far too ambitious. 21 results statements, 3 objectives, 3 communities of practice, 6 agencies, 3 languages, 47 time zones. The level of complexity was incredible. Not only were we trying to achieve field level improvements in capacity, but organisational transformation and sector transformation. It's incredible scope of ambition. For me, that was far too much. We tried to do too much, and I think, as Graham says, if you focus on one of those things, like maybe field level improvement of capacity, you could do that, or focus on organisational transformation. Perhaps you could do that. For me, taking away from this, I think I would say that I'm fairly resistant now to heavily intellectualised, top-down driven capacity building projects. I think that way danger lies. Wherever possible, capacity building needs to be driven at the field level with support from international community and other stakeholders within the aid system. That way you get the ownership, you get the momentum, you ensure that it's relevant, it's appropriate, and you then bring in the international community to act as a sort of a broker or a facilitator or support service. That for me is how I think now about capacity building.
Thanks. Does anybody want to address the question about people with disabilities?
Yeah. Well, I was going to say there's sort of a segue into that, and it's also the gap between the INGOs, the professionalism question. So actually, I mean, Harun, I don't know if he's on yet, but he did mention that this was a sort of almost spontaneous. One of the our indicators for the Good Enough Guide was how many languages it got spontaneously translated into, because it was the thing about these tools. I mean, it's not something developed at the headquarters. It's something that we developed together with the field. Actually, for the Good Enough Guide, the first version was developed at headquarters level. We sent it down to do a training of trainers type thing, and there was a big reaction saying, no, this is not what we want. So we changed the whole paradigm and ended up with kind of a ghostwriter, where people would try things out, they'd feed back. And so if you look at the back, the Good Enough Guide is quite small. If you look at the back, there's like 70, 80 authors or something like that. And a lot of these people are field-based. And these things were being tested each time, this sort of cycle type thing. And that's how it kind of came about. And that's true of all these things. So it's not that why were they used? Because people felt like they contributed to this thing. They were what they needed. So that kind of helped a lot with not just with the local organizations, but also in terms of, because another accusation that was sometimes levied at the ECB was that this is sort of parallel to the transformative agenda. It's a duplicate process, this type of thing. But actually, what we saw at field level, I mean, Harun mentioned the government, but it was also kind of brought the UN a lot into it as well. So you actually see the strengthening of these things into very practical working arrangements. For the disabilities question, I mean, that's something, actually I don't know the answer to that. Harun would probably be in a position to say that, but it's basically because these assessments formats and approaches are not being defined at global level. We don't know exactly, they're all different for each consortium. There's some similarities, but they're adapted to those specific things. So I know that there are questions about that, disability, about gender, but Harun would be in a better position to say, okay, what that actually looked like in practice.
I'm afraid he's not online anymore, but we're still attempting to connect back. Yes, well, let's take another round of questions. I've got a lot, actually, online. I'll take one from Julian, and then I'll read out a couple here. We just wait for the microphone, please. Yeah.
Hi, my name's Julian Schrodecki. I work for World Vision International, and I was part of the design of Phase 2. So on the subject of the disability question, I remember at the time, at a design level, there was a very strong emphasis on trying to narrow the scope down to tackle 3 or 4 key issues together rather than make it about a lot of all the other valuable issues that are out there. I remember a lot of discussions about what should be in and what shouldn't be out and why. So that would have been very seriously considered at the time. But I think the panel have already made some excellent points about how funding was an issue, people's time was an issue, and it's really difficult for the project to do everything. My question to the panel is this. If we look at humanitarianism as a narrative, going back to whenever, ECB was a big thing in its time, a big part of the landscape, and now it no longer is. And I'm wondering what you would say is the kind of the one thing that the ECB has kind of really left behind or influenced going forwards towards a kind of ever-evolving narrative of humanitarianism. Thank you.
Okay, thank you very much. As I said, I've got a lot of input from our online audience, which is great. I'm going to read out a comment first and then a couple of questions. So we have a comment here from David Eisenbray from the International Federation of Medical Students Disaster Response Working Group, who says, as a military veteran, I'm very encouraged to see the response community embrace simulation. When I was with the U.S. Air Force Disaster Response Coordinator, I was the U.S. Air Force Disaster Response Coordinator for the Pacific, I found that the best way to bridge the gulf of misunderstanding between various agencies, NGO, government, military, was simulation. So that's a comment on that. We've got a question from Elizabeth from Oxfam, Somalia in Nairobi. And she said, there are so many good materials and publications produced during the ECB tenure. Is there a plan to host them in another platform? Or in 3 years, will they be lost? I think we can answer that one. I think LNAP has taken the initiative to host those resources, Elizabeth. So I think we won't lose them. And LNAP, as you know, is hosted here at ODI as well. And then we've got a question from Gail from the Canadian Red Cross. How do you measure change in capacity? She, in parentheses, she says methods of the project. So that's a big question. I'll be looking forward to hearing your answers on that one. And then I think we'll move back to our audience in the room. Glenn.
Sure. Glenn Houston, the Cash Learning Partnership. I guess I'm looking for any immediate recommendations that you might have regarding the institutionalization or this organizational transformation that David mentioned regarding capacity building. We have capacity building program within the Cash Learning Partnership. We get 1 or 2 people, but it doesn't necessarily translate to the institutionalization or that organizational change you're looking for. Having facilitated some of the ECB courses, it leads me to wonder as well. I mean, you've got 1 or 2 individuals, but it doesn't necessarily mean the organization is going to completely change. Any thoughts on that?
Great. We've got Harun back on the phone line. So, Harun, welcome back. Can you hear us?
Thank you.
Great. So please do, if you have any questions for Harun. I think there was one, Jock.
About disability.
This was about disability, Harun, and how you either thought about or addressed that issue within the consortium in Bangladesh. And I'll ask you, I'll come back to you in just a minute. I'm just going to see if there are any other questions right now. Anything else at the moment? Sarah?
I had two thoughts, which maybe the panel wants to comment on. Is how could you get NGOs to be less focused on their own individualism rather than to the greater good? Because we've also, the issues in ECB, I felt, was some of the same in working with CBHA, when it seemed to be more about what the individual NGOs could get out of the money rather than the greater good. And then what message could you give to donors to be perhaps a bit more flexible in the way they give money, so that it can be a bit more innovative, and you're not so much donor, particularly institutional donor money, is given with conditions and, oh, you've got to get match funding, and this whole thing means you spend more time trying to find money rather than spend the money you have in a constructive, innovative way.
Thank you. And Bobby, did you have... I thought you had your hand up. No? No?
I had a slightly naughty question.
Well, that's all right. We'll have that. Thank you.
That I was mumbling in Stephen's ear here. But just no, actually, it's actually very good to see a project move forward and then decide to close down. I think sometimes that's very good. Learning from some of this that can be a very good thing. But the slightly naughty question is being hosted under ALNAP. What was the relationship with ALNAP at the start, and was there a reason why it was set up separately from ALNAP? Issues of multi-initiatives and all of that sort of stuff.
Thank you. Okay, I'm going to return to our panelists. Let me start with Harun, because we don't want to lose him again. Harun, you didn't hear the full question, but one of the questions was around whether the ECB project considered disability and issues of disability at the design phase and how to include those. Julian Shordecki here in the room from World Vision clarified that at the sort of principles level or design phase here, there was discussion about it, and also at honing down on specific issues. But what was the experience in Bangladesh?
Okay, thank you so much. If I understood correctly, the question is that whether we have considered the issues of disability in our project design and implementation. Am I correct? Yeah. Okay. Yeah. To be very frank, yeah, they're like for us, probably it was not a specific focused area. But having said that, we haven't, of course, forgot about the disability and inclusion issue, because if you see our joint needs assessment approach, we call it the multi-sectoral and multi-stakeholder approach. And at the initial days of disasters, when we collect the basic information, we definitely consider the disability issue, the gender issues, the social, the marginalized issues, all those issues. But we haven't kind of taken any specific kind of activity on disability. Maybe yeah, exactly.
With, which was, I think it was Gail from the Canadian Red Cross, was asking about how do you measure change in capacity? What sort of methods were used in the project? And I wonder if you have any reflections from the Bangladesh consortium experience on that.
Okay. Yeah. Of course, I will share our experience, and I think David can also add. In our project, we had a mini system we called it CSET, Consortium Self-Assessment Survey. So this is a self-assessment the agencies do by themselves. So we have a questionnaire focusing on all the kind of thematic areas. There are different questions related to organizational capacity, related to accountability, disaster risk reductions, preparedness, response, etc., etc. So every year, the organizations, they fill in these questionnaires. Then we compare the last years to these years. Thus, we track changes and we measure the impact. And also, I think that we also did different qualitative we did use different qualitative tools like the discussions, FGDs, or key informant interviews at different level of organizations. But having said that, it's a very good question that, it's really very difficult to measure this change. Thank you. David, you want to add something here?
Sorry?
Yeah, if David wants to add anything here, because...
Yes. David, anything to add?
Yeah.
He's keen.
He's shaking his head, Harun.
Yes.
I'm not
yeah.
sure.
No, Harun, thank you for that. This on being part of this panel is actually therapy for me, and it's thank you. No, it's a really good question. The M&E of this project was extremely complicated. I'll say a couple of words on it. The top line objective was improving speed, quality, and effectiveness of humanitarian response. And Harun's already mentioned and talked about the consortium self-assessment survey that was run once a year, every year for the 5 years. We also had an agency self-assessment that was run once a year for the 5 years. And that was one pillar of the M&E system. There was also the reports, so kind of annual and quarterly reports were also the second pillar. Simulations actually were a third pillar. They were used to track changes both in terms of organizational preparedness and response, but also individuals, so how individuals have changed or improved competencies and behaviors. And then lastly, evaluation. So the idea was you would take sort of, if there's a big disaster in a country, say for example in Bangladesh, the idea was that you should be able to see in that evaluation that things have improved, and you should therefore be able to show plausible association between the activities of the ECB project and the improvement in the way that things are carried out in country. Of course, the reality is much more different and more difficult to prove than that, and the whole project was built upon this idea of plausible association, that if we as individuals and agencies input in resources and money into capacity building initiatives, that will lead to individual and organisational changes which will add up to improvements in speed, quality and effectiveness of humanitarian response. That's the theory, but the reality was so much more difficult than that. And I think in some of these documents, it's kind of there's a few documents online which talk about some of these challenges, which I'll encourage people to take a look at.
Okay, thanks. Jog.
Yeah. Well, I'm glad you're being you're finding useful therapy. I think maybe it's a little bit more positive than that. I mean, I'm not known as...
Yeah. Therapy can be positive.
Yeah.
Yes, exactly.
I mean, as the example, I mean, I showed the sort of graphic of the Indonesia example. They have part of their protocol is that whenever they do they don't just start with a joint assessment. They already are planning for a joint evaluation after it. And so you'll see that there are at least, I think, 2 examples of joint evaluations. So they do not just the evaluation, but it's actually using that evaluation. They have a review process after the evaluation. So there already you get some good, pretty good proxy indicators, and you can see lots of other things happening where they're getting a lot more systematic. Whereas the kind of baseline was the Yogyakarta earthquake, where they were basically surveying the same areas, forgetting about the people that were far away, exactly like the simulation today, and it was sort of a self-realization. They don't do that anymore. In Bangladesh, there's a very interesting kind of outcome indicator, I think, in the form of government minutes. I think it was 2012, was it, where basically the government, in this meeting chaired jointly by the UN and the government are expressing pleasant surprise at how organized NGOs are and how useful this assessment information. They'd never seen it before. And as Harun explained, that sort of opened the door or changed actually the attitude, or what was one of the contributing factors, not the only thing, that helped to change that and improve that relationship. So, I mean, there's some fairly clear indicators. The problem was that we weren't really tracking that in the way that, there's some M&E specialists here. Okay, could we have done it better? Oh, for sure, I think.
Before I hand over to Graham for some comments, there's an important question here I just wanted to throw into the mix of the discussion from Sandrine from MSF. And Sandrine asks, did the ECB make a difference between conflict scenarios, or differentiate, perhaps she means, between conflict scenarios and natural disaster response. And she says, thank you for the discussion, it's really interesting. So Graham, I'm going to hand over to you for your words of wisdom on the whole range of questions.
Okay. Glenn's question on how do we move away from just individuals and organisations. I mean, I really recognise the question because I think that was very relevant to ECB in that there was a few people in all the organisations that were pushing hard, and how do you drag the rest of the organisation along? I think there's two things, neither of which I think we've done well enough on. Is one, doing an awful lot of spade work at the beginning, making sure that everybody is involved and participated in the decision about to embark on ECB. And then secondly, a leadership in all the different organisations and the role of the principals of dragging their organisation along. Those two things are really important, I think. Messages to donors, yeah, that's a challenging one. I mean, I think Gates were great. That they were the ones that came up with the initial 5 million punt on this. Our problem was we couldn't find anybody else that behaved like them. That was the fundamental problem. Yeah, and I think this is one of the things that I think the CBHA or Start Network is trying to work on as well, and I think there does need to be an awful lot of work on that for donors to be a bit more enlightened, a bit less project focused. What the solution is, yeah, God knows. How do agencies try to collaborate and set aside their own interests? Yeah, we weren't successful in doing that in the ECB, and I'm struggling to see any examples of any collaborations that avoid that. I think it's something really difficult. We've got agendas driving each of our own organisations, budgets, especially with the last 5 years and the financial situation for a lot of agencies. I just don't think that's ever going to go away. And I think having a bit of realism about that and recognise that whilst we collaborate, we also do compete, and we need to recognise that. And if we're quite hard-nosed about that, then I think we'll do an awful lot better than thinking, oh yeah, we all love each other and it's all going to be fine. I think going in with that naivety will do us no favours whatsoever. Yeah. I'll let somebody else answer some before.
There was a question about the relationship with Al now.
Oh yeah.
Yeah. Well, okay, so there were three objectives in the second phase. Okay, objective one was consortia. That was the field thing, which we've been talking a lot about. Objective 2 was the building capacity of the participating agencies themselves. That was a self-assessment type of thing. Objective 3 was everybody else. Okay, what's the benefit? What's the relationship? How can this benefit the humanitarian sector as a whole? And within that, there was the intention to identify specific strategic partners, okay? And most of those were on the accountability side. There was ALNAP is one, HAP was one, Sphere was one, ACAPS came along a bit later. There was also, but on the staff capacity, there was also people in age. Anything else? But anyway, I mean, the relationship with all those they were actually involved from the design phase of phase 2. In phase 1, there was a few misunderstandings, partly due to communications, and partly due to different other kinds of things. But it was always ALNAP was always working with us, and apart from the actual agreement to take over the archives, there's also in this paper I mentioned another kind of innovation that we were involved with as the accountability advisors, which is this humanitarian genome project, which is basically trying to promote the use of evaluations by making results and lessons a bit more accessible and easier to synthesize. And that's something else where ALNAP has been involved quite closely. So is that a fire alarm or something?
I don't think so.
Okay.
Yeah.
I thought we were going to have another simulation.
Yes, a SNAP simulation, which we haven't warned you about.
Yeah. Okay.
Was there anything else?
Well, there's a conflict thing.
Yes.
Yeah.
Please.
The question about conflict and natural disaster, because of the choice of the consortia, it was mainly natural. So it's Bolivia, Niger, Indonesia, Bangladesh, and then there was the exception was the regional consortia in Nairobi, which was for the Horn of Africa. And there was some conflict, very much so, because that was during the food and conflict crisis in Somalia, for example. So that was kind of the major focus in phase 2 of that particular one. And just as an example of how that changed, in that, that we've been talking a lot about joint needs assessment, which all the other consortia were doing fairly systematic. In Kenya, that took a different, there was a kind of joint needs assessment, similar type of thing, which was where the UN and government were involved. But one of the major activities was actually not just doing the assessment, but it was actually training national staff or national NGOs to go and do the assessments in Somalia, because the ECB agency staff themselves didn't have any access. So it was kind of, okay, so, and that's an example of how you can, where the field can decide what's the appropriate thing. Because we were expecting to do a joint needs assessment like all the other consortia, but actually it turned out now we need to have a different approach because of access.
Thanks. David, Graham, any final comments?
I would like to answer Julian's question, because I think it's a really good question. Yeah. Julian asked the question, I hope to paraphrase, what if there's one thing you can take away from ECB, what is it? What's the one good thing? And I think a lot of conversations and movement towards having a local first, and not us doing capacity building to people in the local context, not that, but what's your idea in Bangladesh, in Niger, in the Horn of Africa? What do you want? What's your idea? And I think that idea has grown through the ECB, and I think if there's one legacy from the ECB, I think that's it, and I'd be very proud of that.
Mm-hmm.
Okay. David, do you have anything to add?
Yeah, just a couple of things very quickly. I think that just in response to Sarah's point down, within the START network, we are currently working on a paper that's looking at donor controls and how we can work with donors to try and make things a bit more flexible, so we're not so focused on log frames and linear mechanistic approaches, and a bit more adaptive programming. So we're working on something in that respect, and we have some ideas about how we might do that, and that's something that some agencies within the START network are working on. So just for your information. I wanted to say a couple of words as well about just on Julian's question. For me, the example in Bangladesh is a great one around Harun reporting back now, sort of 6 years on, how the government is now taking on the approaches to joint needs assessment and talking about coordinating agencies. And for those of you who've worked in Bangladesh, I mean, many years back it was a traditionally chaotic assessment environment and very difficult. And these, you're looking at a very practical change that may have actually had a big impact at the policy level in the country. So I think that's a significant achievement, and we have other examples. Like the creation of the Good Enough Guide was a brilliant initiative, and it showed how people working at the international level and how people working at field level can create something that's genuinely useful and can actually transform the way we do business. The co-creation of the Towards Resilience Guide was another great example of how collaboration, admittedly there are pain points along the way, but how collaboration can create something that's useful and is now being translated into goodness knows how many languages. So you have all these examples of within the ECB project that where it works well, where collaboration works well, it can be incredibly powerful in changing the way that we do business. And for me, that's the one takeaway, that where we get it right, collaboration is a game changer.
Thanks very much, David. Harun, are you still on the line? No? Okay. I'm sorry we've lost Harun. Well, we've come to the end of this session today, and I wanted to thank all of our panelists. And I think I'd really like to thank them for being so honest about the challenges and the issues, because I know that's not an easy thing to do. And although we are in a safe environment, we're also in a public online environment too. And I think it takes some courage to talk about what the real pressure points are, what the real issues are that you have to deal with, because not everybody's willing to do that. And I hope that agencies and groups of organizations that are embarking on new collaborative initiatives do take note of the lessons that Jock has outlined in the paper. And I hope you enjoyed the discussion today. So thanks to all of you, to our panel, and to the online audience for your participation. Thanks again.
Thank you.